Live from Wave in Louisville, Kentucky. This is Listens Live.
Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. It is Friday. Happy Friday to you. We have a great show to send you off on your weekend here today as we get you to the rundown now and show you the guests you can expect on Listens Live. We have First Savings Bank here to talk all about interest rates, both borrowing and saving. So we'll talk to them coming up. We have the Brick Convention in town happening this weekend, and we'll share how you can experience the world of Lego coming up. But up first here today, we have Kentuckyana Pain Specialists back to talk all about their comprehensive alternative treatment options for chronic pain. And as we bring you back here into our studio, I have Dr. Aith Nair here with us from Kentuckyana Pain Specialists. Good to see you again.
Great to be here, sir.
It is a Friday. This is important stuff, and let's dive right into it. You have brought with you today a pain pump, and we were going to discuss, if people are hearing about that for the first time, how it works, how it could bring some relief.
Great. That's a great question. Well, this is a model of the pain pump. It's a device that will deliver pain medication in minute amounts directly into the spine to help with chronic pain. You know, patients can have chronic pain from various conditions. Could be from, degenerative disc disease, failed back surgery, accidents, anything that causes chronic pain. Even some patients who have severe pain as a result of cancer would benefit from this pain pump.
It sounds like there's a lot of people who would benefit. How then do you decide if a patient is actually a good match for this type of treatment?
Of course, the most important thing is, I would evaluate the patient, get a thorough history, and I would see what treatments that the patient has already gone through and whether they've been successful or not. Sometimes patients have been on pain medications for years without much improvement in pain. And at that point, trying the pain pump is a good option.
For those patients who are listening to what you say and they say, man, I've had chronic pain for years, I've tried this, and nothing has worked. I want to know how effective the pain pump is at managing chronic pain. And obviously it depends on the person, I'm sure, but are you able to rate its effectiveness for that?
Well, of course, I would be able to rate it as a physician, but the great thing about this device is that the patient gets to have a trial where we give them a small dose of the medication directly into their spine, and if they benefit, if their pain gets better, and they have no side effects, then this would be a great indication for them to have this device.
Let's talk results and what you've seen out of your patients so far.
Well, out of all the patients that have implanted pain pumps, the vast majority, and I'm talking about more than 90%, 95%, they do very well. We do evaluate the patient, and we kind of make sure that the patient would be a good fit for this technology. We do the trial, so the patient gets to know whether this thing will work for them or not. So only after going through all these checks and balances do we move forward with this pump implant.
What does the procedure typically look like? And I know aftercare is a big part of that as well. A lot of folks want to know, okay, what does this exactly look like for me if I'm somebody who is a patient that qualifies?
Well, after we perform the surgery, the patient recovers for about 2 weeks. Their staples come out in about 7 days, and they can resume their normal activity after that.
Okay, so it's a pretty quick time there with aftercare. Is there any advice that you have if someone has been dealing with chronic pain and they say, I just don't know what to do next? What would you want them to know?
The first thing is do some research on their own. Go online. There's plenty of information, and call our office, set up an appointment. I'd be more than glad to, talk to the patients about how this device works, what are the pros, what are the cons, and whether it's a good fit for the patient. And then we go from there.
I want to talk for a bit about Kentuckyana Pain Specialists overall. If people have not been in before, haven't been seen by you specifically, kind of walk them through what to expect.
Well, first, of course, they would have to call the office, make an appointment. We try to get our patients in as quickly as we can. Patients come in, they fill out a questionnaire about their pain, and then I will come in, evaluate the patient, and then we'll discuss. The discussion starts there. And we talk, if the pain pump is an indication, we'll talk about that. If not, some patients will benefit from injections, epidural injections, joint injections, ablation surgeries, and we try to tailor for the patient the best treatment options and modalities.
Whether it's someone who is suffering from cancer or who was injured on the job or a host of different reasons that they have this chronic pain, have you seen, especially in our region, is this a major issue that people are dealing with right now?
Oh, absolutely. I think chronic pain is nationwide. And there are a significant amount of patients that have this condition. And, I try to optimize the patient's treatment and improve their quality of life. And that's what this is all about.
It seems like the pain pump fits perfectly into this next question, but throughout your career as you've worked on managing pain for patients, how has technology and advancements in science helped to change the treatment options that are available for people? Maybe someone out there who's dealt with this for a long time that didn't even know that this was out there, that this was an option for them.
Well, interesting enough, this pain pump has been around since the early 90s, but there's not that much of an awareness about the existence of these type of devices that can help with chronic pain. So, as the awareness improves and gets better and patients are aware that there are better ways to treat pain, that's when they'll start researching and they'll look for doctors like myself that can do this.
At risk of getting too scientific with this next question, if somebody were to ask, okay, we know Kentucky, one of the states that dealt heavily with the opioid crisis, so when people think of pain management, especially in the news, that's something that always comes up. And so if somebody were to ask, okay, how does the pain pump work exactly? Again, I know that might be tough to do without getting too scientific, but if you can, just an explainer for our viewers here today.
Well, the pain pump, the best thing about it is that it delivers pain medication directly into the area where the pain receptors are. So it's unlike how pain is controlled when you take pills, because it has to go through your gut and through the circulation. So you can use very small doses of the medicine that's directly delivered into the spinal fluid with better and tighter control of pain.
For you as a physician, why did you go this route and decide this is how I want to make sure that I can care for people?
It is very rewarding for myself, but I think it's even more rewarding for the patients when they're able to spend time with their loved ones or their grandchildren, and they're able to do the things that mean something to them, and their quality of life is better. That is the main reason why I do this on a day-to-day basis.
Well, we thank you for bringing something that many folks maybe haven't heard of before and letting them know about these resources. Last thing I would ask you before I let you go is if somebody watching today says, I need to learn more about this or wants to do a consultation with you, what's the best way to go about doing that?
Pick up the phone, call my office, and we'll get you in.
Okay. Well, Doctor, thank you again so much for being here. We've got the phone number and the website for Kentuckyana Pain Specialists right there on your screen. If you've been suffering with chronic pain, then you know that Kentuckyana Pain Specialists provide some comprehensive alternative treatment options for that pain. Thanks again for being here.
It was a pleasure. Thank you so much, Brian.
See you back here soon. Have a great weekend.
You too.
All right, stay with us here on Wave Listens Live. 2 more segments to go. Coming up next, we'll talk all about interest rates on this First Savings Friday with First Savings Bank.
The Wave Charlie Wilson's Jen Air Kitchen is furnished by Miller's Fancy Bath and Kitchen, Kentuckyana Countertops, and Annabelle's Oriental Rugs. Thanks to these great sponsors.
Be prepared every day with your accurate weather forecast from meteorologist Tawana Andrew. Weekday mornings on Wave News Sunrise.